Going back to my colleague's questions around staffing levels, I want to ask about the department within your agency that processes the applications to become a cottage food operator. I hear from numerous individuals in my district around the state who have to wait weeks or even months to have those permit approvals. Are you appropriately staffed to handle the volume of interest there?
So we are working closely to be as responsive to the volume of cottage food applications that we're receiving. That number, of course, is growing, and it's not just growing, but it's becoming more complex in the types and nature of the applications. And so we're continuing to assess how we can make, as I just mentioned, improvements to those processes, but also ensuring that we have the right skills in place, the right people in the right sections to be as responsive as possible.
Yeah, I wonder if you are appropriately staffed, because as you just said, interest is growing, I think for good reason. There's an interest in this statewide. And part of my concern is not only do you have growing interest, but I feel that the state of New Jersey has some particularly burdensome regulations and prohibitions in this space. The state prohibitions on home bakers sometimes make it feel like it's not safe to eat anything at home, and yet we have farm-to-table restaurants, independent bakeries, farmers markets that provide a lot of the same food with the same ingredients. There are not government inspections at every step of those processes. So what's the difference here? Why hold them back as if they're a public danger?
Sure. So again, our priority in public health is public safety. And the regulations that govern food safety in our state, whether it be cottage foods or fast food or even at a farmer's market, are intended to minimize the risk to our residents from consumption of those products that people might purchase. There are a lot of as I mentioned earlier, the nature of the foods that are being proposed are getting more complicated. Oftentimes can be difficult for even those residents to decipher their recipes. And so our teams are working with them as closely as possible to try to, again, not be a barrier, but also to continue to protect public safety, but also recognizing that it is a home. And the type of equipment as well as the conditions in home, the systems for managing what's happening as they're being prepared there are different than you would see in a commercial restaurant.
Understood. Well, we agree on increased interest. I'll accept your argument on increased complexity. It's logical. I hope you'll contemplate the prohibitions in place and whether they are too onerous, because all of these factors come into a question of staffing, which at the end of the day is what we're most concerned about in the Budget Committee. If I may shift gears. You noted in your Senate testimony and in the OLS analysis in front of us that New Jersey was awarded $147.3 million from the Centers for Medicare and Medicaid Services Rural Health Transformation Program, which was created by H.R. 1. Do I have that right?
That's correct.
Okay. Could you please break down how that funding is being used, where it will be going, and how much to each grant recipient?
Sure. So I'll start by saying that the Department of Human Services is actually the grantee for the Rural Health Transformation Program. There are funds coming to DOH. I'm happy to provide a breakdown of each of the line items to you all through the chair. We have not yet made any actual awards to grantees, though. We will be making, we have several RFAs that have already closed, and determinations on those awards are pending. And then we will be very happy to share a list of those pending awards once the determinations we're able to share who's receiving an award.
So my concern is that what has been broken down and what we have in front of us publicly and otherwise, it breaks down $54 million worth of line items. There's an additional $96.9 million that is unaccounted for. Are you telling me it's the other guy? It's Human Services?
No, I'm happy to provide our grant application. As you know, this is a federal grant that we had to submit to CMS.
I don't need the application. I just want to know how that's broken down, the $96.9 million.
The breakdown is in the budget for the grant. So CMS, this is a cooperative agreement with CMS, and so we are happy to provide a budget to you all.
Do you plan on receiving receipts and financial disclosures from grant recipients?
We plan on adhering to the usual requirements for all grants in the state.
I'm concerned about the usual requirements for grants in the state, because so often we make a grant, the state of New Jersey makes a grant, and there's very little follow-up, and we don't know how it's spent. I think we need receipts and a higher level of public transparency.
Of course, yeah, and this is, again, a federal grant, so there are even further enhanced conditions that we must be compliant with on federal grants. Our partners at CMS are reviewing every contract that's associated with this funding, and so there is pretty significant oversight, and of course, we also, as a state want to always be in compliance.
Thank you very much. My last topic. The state advanced $25.8 million in charity care payments over the 3 fiscal years to Heights University Hospital, which was discussed several times today, and provided a $10.625 million loan in fiscal year 24, all of which, but $200K, was discharged in bankruptcy. Provided also a $2 million emergency payroll grant in fiscal year 2026, a total state exposure of approximately $38.4 million before a $128,000 penalty. If we're all on board with the numbers there, why was the $10.625 million loan discharged into bankruptcy?
Assemblyman, I'm going to not speak specifically about this situation because of the pending litigation, but the determinations around bankruptcy are made in bankruptcy court.
Can you tell us who approved the discharge?
Those determinations are made in bankruptcy court, but I'm happy to provide further details that are available to us back through the chair.
Understood. Was the legislature notified of the bankruptcy?
I would have to ask, and I'm happy to provide that back as well through the chair.
Okay. Do you know why the loan was not secured against the facility's assets?
Again, I wasn't here when this happened, but I would have to investigate to get any additional details back to you on that specific item.
I would appreciate it very much
Sure.
through the chair. That was the look back. Let me ask you about the look forward. Governor Sherrill's spokesperson stated that after Heights University Hospital closed, that the governor would pursue more tools to hold healthcare facilities accountable. 4 weeks after the closure, what specific tools are we talking about?
It is important that we, as a state, and really that's the partnership with this legislature, have enforcement tools. And so I look forward to, as the legislative process moves forward, being able to talk about what options we might have in front of us.
Okay, you're going to have ideas to bring to the table. They're not fully baked yet. Is that fair to say?
I certainly have thoughts about it, but no, I don't have any to share right now.
Okay. My last question, the department has assessed Heights University Hospital approximately $128,000 in penalties that I referred to earlier for shuttering the hospital's services without the state's approval for 90 days notice according to law. The state's existing hospital financial monitor authority was deployed, but did not prevent or provide sufficient advance notice of the closure. There also appears to be a $3 million worth of unaccounted lapsed funds from the Continued Access in Underserved Communities pilot program that supplied the monitor. What happened to the $3 million in unspent funds, and do you know how it will be used?
Assemblyman, I'm going to have to actually get back to you through the chair on that. And again, I hope you can respect that we are in litigation around all things related to Heights, and so I will not be able to provide any speculation either.
Understood. Thank you very much,
Sure.
Commissioner. Thank you, Chair.